that only 5 to 10% of cancers are hereditary, and the lifestyle choices you make can have a direct impact on your overall cancer risk. Here with more, nurse practitioner and smoking cessation counselor at Spectrum Health, Courtney Lane. Hello, Courtney.
Hi.
How are you this morning?
Good.
Okay, so most people, when they think of cancer, the very first thing they think of is smoking. Okay,
Yep.
Smoking's got to be number one. But right behind that, you would think that most people would say, well, my dad had it or my mom had it. If they ask you for breast cancer, does it run in your family? You hear a lot about genetics, but 5 to 10% seems like a pretty low number. You'd expect that to be higher.
It really is, yeah. There's preventable disease. It's a preventable disease, not always, but it's not necessarily. It is preventable.
I mean, some people might be thinking cancer is preventable. How does that happen? You know, February 4th was World Cancer Day, day for the world's population to unite in the fight against cancer. Tell me about what happens each year on World Cancer Day. What do we do? Is it informational?
It's really informational.
Okay.
That all around the world, people try to get together and raise awareness about cancer. They try to educate the public, dispel rumors, things like that, so that people really have good information. And the aim is really to decrease preventable deaths from cancer.
And how has that changed over the years, cancer-related deaths? I'm assuming, since there has been quite the push over the past couple of decades to reduce smoking, that hopefully that's had an effect on cancer deaths.
Yeah, smoking's had the biggest impact, I think, on cancer deaths, with less people smoking. The American Cancer Society statistics that they put out has shown that cancer deaths are down about 25% since its peak in 1991. Smoking's the biggest impact on that. Also, there's a lot more screening out there than there used to be in the past, and then advances in cancer treatment all play an impact. But prevention, again, is a key role in aiming to get that cancer statistic improved.
I think many people hear about how once they get cancer, how the advancements in how we treat cancer and how we've extended life in the medical community is making leaps and bounds in that field. But to actually stop it before you get it, some of these things are going to sound like, well, I don't know, maybe hard to believe that they can actually prevent cancer, but stopping smoking obviously is key. But beyond that, what are some of the factors that people can do to actually prevent their body from getting cancer?
So a lot of them are just normal things: maintaining a healthy weight, preventing too much sun exposure, wearing protection, SPF, things like that, getting immunized, seeing your doctor on a regular basis, seeing what those normal health screenings are to detect it at an earlier state. Many cancers you can detect at earlier states, such as breast cancer, cervical, colorectal, lung, prostate, lots of different cancers.
That's a long list of cancers that you can get in front of before they actually have to happen.
Absolutely.
And when you talked about protecting yourself from sun, getting immunized, and a healthy diet, those are some of those things that, well, they sound like they make sense. Okay, you would use that for numerous things, just for overall general health. Are there other signs that people can look for to say, I really need to look into this? Like, I know that some people say for men, for prostate cancer, bladder, when they're having trouble stopping or going, as they say in the commercial. But I mean, there are other signs that you can look for to say, hey, maybe I should look further into this quickly.
Exactly. The most important thing is to know your body and know what's normal for you. And then also acknowledge when something changes. So changes in bladder and bowel, such as that you mentioned, ulcers that aren't healing, any lumps, bumps, thickening areas that have changed, warts or moles that have changed, abnormal bleeding, discharge, things like that. Things that are changed or different. Those are the times when you want to talk to your doctor.
Okay, well, make sure that you do that, because cancer, you heard it again, is preventable. There are things that you can do. I appreciate you coming in today, Courtney, and giving us the information. Awesome. If you have been diagnosed with cancer and you would like a second opinion or a consultation, there's a place you can go. Call 1-855-SH-CANCER. That's 855-742-2623, and get the information you need for your health. Coming up.